Good evening, and welcome to Adult Children of Aging Parents, or ACAP. My name is Michaela Tate, and I, along with Bruce McReynolds, serve as co-chapter coordinators of ACAP Guilford County. On behalf of the ACAP community leadership team, we would like to welcome you to tonight's presentation entitled Strategies for Effectively Managing Medications. ACAP Guilford County programs are presented on the third Thursday of each month at 7 p.m. You can visit with upcoming events section of the ACAP community website at acapcommunity.org to view these presentations. We hope that you will join us for our upcoming programs. The topic for our May program, Communicating with Someone Living with Alzheimer's Disease and Other Dementias. This program will be held on Thursday, May 19th. Be sure to subscribe to our ACAP community YouTube channel and click on the bell notification icon to be alerted for future videos. If you would like to be notified of upcoming programs, you can email us at acapguilfordcounty@gmail.com to get on our mailing list. We invite you to visit the ACAP community website for information on upcoming programs from all of the ACAP chapters. You can also take advantage of expert-led content in our podcast library found on acapcommunity.org.
Very good. Well, Michaela, and also just encourage everyone to check out our Facebook page, ACAP Guilford on the Facebook. Our programs stream live on Facebook on those third Thursdays. You can also like us there, and that will also get you some advance notice of our monthly program. So we would like to thank 4 of our annual sponsors who make all of our programming possible. We'd like to thank Griswold Home Care, Providence Place, Health Team Advantage, and Booth Harrington and John, attorneys at law. We appreciate their support and for making this possible. But tonight's program is sponsored by the Health Insurance Shop. Jeff Shell is an independent insurance broker and partner with the locally owned Health Insurance Shop located here in Greensboro at the historic Revolution Mill. Jeff has been a licensed agent since 2012 and joined the Health Insurance Shop in 2018. The Health Insurance Shop specializes in helping individuals enroll in Original Medicare, in Medicare Supplement, Medicare Advantage, and prescription drug programs. They also provide help and guidance with health insurance marketplace plans for those under 65 and short-term medical plans for times of transition. The Health Insurance Shop is unique because they represent all the major Medicare plans equally. They do not charge for their help and guidance, and they do not favor one plan over another. They are also the only local insurance company recommended by the Triad Health Care Network, who is an accountable care organization for Cone Hospital. To help individuals make smart and more informed decisions, Jeff and the other 13 agents who he works with provide monthly educational programs throughout Central North Carolina. If you'd like to learn more about the Health Insurance Shop and the services that they provide, we invite you to contact Jeff and his team at 336-763-0775 or reach out to them through their website at healthshopnc.com. Michaela, I'll turn it back over to you.
Thank you. So I want to jump right into our topic for tonight's program, strategies for effectively managing medications. We're excited to have with us this evening Ellen Fulp. Ellen earned her bachelor's degree in pharmaceutical science and her doctor's of pharmacy degree from the University of North Carolina at Chapel Hill. She completed her master's degree in palliative care at the University of Colorado in Denver as the only pharmacist member of the inaugural class. Ellen is board certified in a geriatric pharmacy, specializing in safe, appropriate medication use in the elderly. Since 2013, she has been on staff at Avocare and an independent hospice pharmacy benefits manager. Currently, Ellen serves as the Director of Pharmacy Education for Avocare. She routinely provides consults regarding appropriate symptom management, regulatory issues, and medication appropriateness at end of life. Ellen works closely with state hospice and palliative care organizations to improve quality of life and medication use for patients facing serious illness. Her professional interests include pain management in the geriatric patient population, medication appropriateness, and expanding access to palliative care resources. Thank you so much for being here with us tonight, Ellen, and we are going to turn it over to you to get started.
Thank you so much, Michaela and Bruce, and to ACAP for the opportunity to speak with you all this evening. As you heard, my name is Ellen. I'm a hospice and palliative care pharmacist, but first and foremost, I am a board-certified geriatric pharmacist. So serving seniors who we know have increasingly complex medication needs and sometimes medication-based or associated issues was really my first passion. And so I fell back from there into assisting those living with a serious illness. And so I'll start by saying I'm a daughter of, kind of aging parents who are taking more medications over the years. And so my passion really associates well to my daily life. And I'm just so honored to be here with you all for this recording. And I'm happy to take any questions that you might have during the live event, but then also even after the fact, if you have questions, I'll leave you with my contact information and I'm happy to share. So with that, I'm going to jump right in and talk about the objectives that will help keep me on track. But again, if you have any questions, do let me know. So just to get started, we're going to talk about the relationship between just the natural aging process, maybe missing medications, meaning we're not quite able to adhere to the prescribed or the recommended regimen for a medication, and how that will impact errors and negative health outcomes. Up next, I'm going to move on to strategies for assessing somebody's physical, mental, and then the environmental risk factors or barriers to taking medications as they're prescribed, which then, of course, leads to missed doses, noncompliance, and just kind of the downstream health consequences. But then maybe the most important thing is then how do we put that into, just everyday practice? So what kind of tips can I leave you with to prevent missed medications, medication errors, and really just having the best medication that meets yours or your loved one's needs? So we can give you statistics and kind of what we know from studies, but if you can't put that into a practical application in your life, it doesn't help as much as we would like. So any real life questions, situational questions that you'd like to ask me, again, I'm more than happy to investigate that for you. So even though, when I share my background is team pharmacy, of course, medication management is my bias. But it's also a passion of mine when I think about medication appropriateness. And so, one thing that I think we have to just continually be open to as we are assisting in the care of someone who's aging naturally and ideally in place wherever they call home and wherever they want to safely reside and manage any chronic conditions that they have, we definitely know medications will come into play. But one of the things that I'm very passionate about as a geriatric pharmacist is making sure that you and your loved one, especially if you're assisting in their care, understand why something has been prescribed. So in pharmacy, we call that the indication. What is the need? How long does your prescriber anticipate the need? What is the risk associated with a therapy? So I'm very forthright with my patients when I'm working with them. You might have a low dollar cost associated with a medication, but you could be paying a high cost, or your loved one could be paying a high cost when we're thinking about the adverse effects or the side effect of that drug. So you always want to know why something is being initiated, how long the prescriber anticipates that need being present, what are the side effects, how long are you going to have to wait for benefit. And then the most important thing that I can encourage you to help your loved one with is just maintaining a current medication list. So that's being your own health advocate. You always want to make sure that you have a fluid list, whether that's on an index card you maintain it on your home computer, having a list of everything that you're taking and keeping that with you or your loved one, incredibly important. So we always say in hospice and palliative care, we're hoping for the best and we're planning for the complicated or the worst outcome, meaning, if something happened to you or your loved one when you didn't anticipate it, you know that you're prepared with the information card or, document that's complete with your allergies and your medications. And then, documenting your response to therapy. So if you or your loved one encounter a new side effect or a new complication, you want to be able to take that back to your physician, to your prescriber, and really just get their input. Is this something now that maybe has side effects or adverse effects that are outweighing the benefit? So that's why I've chosen the graphic that I see here on the screen, because every patient is different. Every loved one is different. So knowing what they want and what's important to them and pairing that with their medications is incredibly important. And then if I could leave you with one concept, I know I'm just getting started, but I'm going to tell you early and often that if I had a catchphrase or a tagline associated with me in my practice, it would be that a medication list is not stagnant. So I always say, question new side effects. Make sure that you and your loved ones who are assisting in your care, or if you're, assisting in theirs, you go to appointments. You take every opportunity to ask questions, to bring up new concerns, because quite often this is a balancing act and things change. How our bodies process medications change, even if we're taking the best care of ourselves. So we know as we age, for example, our kidney function changes. It's nothing that we're doing wrong, but your kidneys and your liver are your two main filters for medications out of the body. So we anticipate that things change. So be open to that conversation and be yours or your loved one's own health advocate when you have the opportunity to face with your prescribers and the clinicians that you're involved with. So this is a seesaw when it comes to medication. So while I'm a pharmacist, I'm not always advocating for new medications, but I'm advocating for what's working well, and how can we best meet this patient's goals of care. Sometimes that will involve deprescribing or actually tapering down on a medication, which I'll talk about in a little bit. So why is this conversation and this presentation so important from your geriatric pharmacist perspective? So one thing that we do in pharmacy a lot is we ask for the numbers. So everything that we're doing, everything that we're recommending, I'm a big why advocate, right? We want to make sure that the benefit is outweighing the risk. So I've highlighted 3 different studies that really kind of approach the negative, impact that we can have on aging individuals with medications, simply because of quantity, because of the place that the person is calling home currently, or the types of medication that they're using. So I'm going to start with study number 1, which was just a survey of over 2,000 Medicare beneficiaries. They were community dwellers, meaning they were residing in their own home, wherever that was. It wasn't a skilled nursing facility or a long-term care facility. They were managing their own medications. And so these patients were in their early 60s to mid 80s. And when we looked at how many medications they used, really almost 9 out of every 10 patients had at least one medication that they used routinely on a scheduled basis. But really interesting, or more interesting to me, we had 36% of participants that used over 5 medications. So these are home interviews. Patients were using medication logs. And we saw an increased use of over the counter medications in combination with prescription products, but almost 4 out of every 10 patients were receiving at least 5 medications. And so this is going to be important to any geriatric pharmacist, because we increase the risk of negative health outcomes, or what we call polypharmacy, when patients are taking at least 5 medications on a routine basis. So when we did a random study for ambulatory kind of community dwelling patients, we saw that our geriatric patients, 4 out of every 10 were at risk for what we call polypharmacy or negative health outcomes. And a lot of those are associated with missed doses or medication administration errors, or difficulty with kind of adhering to how the prescriber intended an individual to take a drug. Study number 2, we have Medicare beneficiaries who were discharged from the hospital to a skilled nursing facility. And so this is what we call kind of a discharge from acute care, or we know statistically we've got an area of opportunity here because a lot of things are changing. So on average, these patients were taking 14 medications, right? So that's almost 3 times the number that we need to statistically encounter something not going well or as prescribed. And so really, interestingly and, unsurprisingly, 1 out of every 3 patients here had what we call an adverse effect noted, meaning there's something not going well with the chronic conditions they're treated for and the medications that we're using. And I mention this to say, I know this is probably something that's not unfamiliar to a lot of folks who are kind of listening and following along with ACAP. So this is a prime example to ask questions or an area of opportunity as you're helping manage your loved one's medications. So there will be a lot of moving parts. We know that. And so it's important to kind of anticipate that we need to be good historians and we need to document what's going well and what's not going well. And question that for your loved one. And then study number 3, this is always interesting to me because as I've shared, my passion is geriatric patients who have complicated care, complicated inpatient stays, and potentially a discharge even to palliative care or supportive care services, or they're even being treated or discharged to hospice, meaning they have a more limited life expectancy. Because a lot of patients at these times of transition or care is getting more complicated, they might reach for something that's an herbal or a supplemental therapy or an over-the-counter medication, thinking this might add benefit or offset the need for prescription drugs. I mention this because you can see that the increase in the rate that our seniors are using over-the-counter medications is staggering. So if we look at 1998, about 14% of geriatric patients reported using at least one over-the-counter or non-prescription herbal supplement. And then in 2010, we saw a 63%, reporting rate, meaning we jumped from 14 to 63% of elderly patients or aging patients were using over-the-counter or herbal supplements. So as your geriatric pharmacist on the call tonight, that can be very concerning. And so I would always advocate that if somebody is taking a medication record or you're compiling that medication list for yourself or a loved one, report your over-the-counter supplements. I always say that's about the most dangerous place you can find for geriatric patients. So I'll use a simple example of ibuprofen, which is found in, Motrin, for example, or Advil. That can exacerbate or cause worsening fluid retention for patients with heart disease, especially if we're having some normal kidney decline over time. So always ask your physician or your prescriber or your health advocate before you start a medication. And please always include those on a medication list because sometimes they can do more harm than benefit, even though statistically we view those as benign. So that's kind of the number game and kind of why this is so important. But I would also then say we need to know where the potential for medication errors could come from. And so we know that common errors, especially in our aging population, will come from missed medications. And so we call that an error of omission. We just missed that dose. And that can come from all kinds of, different scenarios. So if you think about forgetfulness, right? So we're busy in our day-to-day life, but if you have a lot of things that you're managing, maybe the complicated care of another loved one, meal preparation, the care of, a pet, making sure that you are scheduling toileting for a loved one. There are a lot of things that could just impact your daily life. And you'll think, I'll get back to it. I'll take this medication at a later date or a later time, rather. There's a lot of errors with omission, and I've paired that with duplication as well. So it's equally as dangerous to take 2 medications, right? That it should be spaced out and taken once a day. It's important to also ask physicians or prescribers What do I do if I miss a dose? How soon should I repeat a dose? Is it safer to wait to take the next dose, or should I repeat it if I'm fairly confident that I didn't take the originally prescribed dose for that day? Dosing errors, meaning perhaps we're filling a prescription toolbox, meaning like a maybe pill box for a loved one. If we don't fill the right number of tablets, sometimes that can, of course, lead to problems and uncontrolled symptoms or chronic conditions. And then the drug interactions I mentioned previously, which is why it's so very important to make sure that we're telling our prescriber everything that we're taking or everything that our loved one is taking. And so when you see the abbreviation ADE or adverse drug event listed later in the presentation, this is just something that was preventable that could cause patient harm because medications are not taken as they're prescribed. So, as promised, I want to talk just a little bit about missed medications and how impactful those can be, because statistically, we see that type of medication error most frequently in our geriatric patient population or our patient population that's aging. So, when I say missed medications, this is a pretty significant source of patient harm or the potential for patient harm because these are viewed as what we call an error. The patient wasn't able to adhere to the regimen as it was prescribed. And so I mentioned polypharmacy being a risk when patients are taking 5 medications or more, but you increase this risk of a missed medication if a patient is taking 3 medications or more on an average day. And so this is important because Medicare estimates that at least 50% of their beneficiaries take at least 3 to 5 medications per day. And we know that this isn't anyone's fault necessarily. We know that genetics, we know that other medications that you're taking for unassociated chronic conditions might require, a third medication, a fourth medication. So it's important for us to embrace that the potential is here and plan accordingly and really kind of assist our parents and our loved ones with planning ahead to make sure that there's a good plan for them to take these medications as prescribed. Because again, it only takes 3 medications to increase your risk of missing medications or having those omission medication errors. The other thing to kind of be aware of, which is so nice to hear about our sponsors for this evening's presentation, is that we can assist our seniors or our aging parents in cost-related compliance. And when I mean that, I mean about 1 out of every 3 Medicare beneficiaries struggles with the cost of medications on an ongoing basis. And so if you have to choose which medications to refill or we don't know to ask, maybe for a generic, if a brand name medication was prescribed to our loved one, we might be setting that loved one up for missed doses as well, especially if it's a drug that's just not affordable. So I always tell my patients, if this isn't a good regimen for you for any reason, we need to know that up front, right? So there's no shame in being honest with, I don't think I'm going to be able to remember to take a medication 3 times a day. Or is this available generically because my budget is a certain number of dollars for my healthcare spending every month. That's not uncommon in my line of work. And so I would advise everybody on the call to make your prescriber aware if there's any kind of anticipated issue or if things become complicated during your patient's or your loved one's course of care. Because again, my tagline will be things change and we need to be fluid and kind of embrace that. So again, dose availability is something that will limit how your prescribers can write a prescription, how your pharmacist can fill your prescription, because maybe your prescriber thinks the best dose for you is 20 milligrams or for your loved one is 20 milligrams, but the tablet comes in a 10 or a 30 milligram tablet. That's going to require your loved one to swallow multiple tablets, to split tablets, and things that once were a bit easier become more complicated when we think about maybe changes in vision or dexterity. So all of these things, I will say, bring them on a list to your prescriber to your next appointment, because even if they're not an issue now, the best thing that you can do is really plan for having a changing medication list that meets your parents' or your loved one's needs. And as I mentioned before, when you're starting medications or when you're rotating to a medication that's more convenient, you want to watch for what we call adverse effects or side effects. And so, one thing that I would always advise anyone caring for an aging loved one is to make sure that there's what I call a diary present, whether they keep that or you keep that. So, for example, if there's a new blood pressure medication started, you want to make sure that you're documenting how that makes you or your loved one feel. So, ask your prescriber if something is not as ideal as I'd like for my mom. When she's starting this blood pressure medication, what is that most likely to look like? And all the patients that you treat, what's the side effect that's most common? What should I be asking for? And hopefully you get some good advice that with most blood pressure medications, you want to make sure that you take it easy and go slow when you're moving from lying to sitting or sitting to standing. You're going to be looking for things like changes in headaches, changes in vision, dizziness, or vertigo. And that's going to be different for every medication. So just knowing what to look out for and keeping a good log for your loved one or with your loved one is incredibly important. So I'm going to ask at this point, Bruce, Michaela, have I missed any questions that have been chatted in just since I'm watching the time closely with you guys as well?
Yeah, one viewer was asking, you hear of possible side effects that, in the advertisements for medications and so
Hmm.
forth. But how do I know if some of the complications that my parents experiencing is due to the side effect of the medication, or maybe there's something else going on?
That's a great question. If you've ever watched TV, if you've ever read the full package insert, there's a lot of scary information there. So I always say, ask for what's most common, because drug companies have to record anything that's ever been reported in a drug study. So ask for the most common side effects. But honestly, with a lot of medications, you're going to see the side effects pretty quickly if it's something that just doesn't agree with your loved one, meaning maybe there's an allergy, there's a drug interaction. So, documenting anything that's new or different in the first days to short weeks after starting a medication is incredibly important. The other thing to kind of just realize, I use the blood pressure medication as my example. Patients change over time. So, their appetite, their fluid intake, meaning how much water they drink, how much caffeine they drink, can change over time. And that can impact how medications change over time. So if your patient or your loved one is feeling poorly and this is something that's new, that's a perfect time to say, hey, doc or prescriber, is this something that you think is related to a medication? I always think it's safest and easy to say, first think medication. So if it's something new in the first days or short weeks after you started a drug, definitely that's going to be your culprit or your suspect first. And then afterwards, you want to talk to your prescriber about what's new or different in your loved one's life and just keep that medication list present. Absolutely.
And what do we do if our family member or parent complains of having too many medications? They just
Yes, yes. So we definitely see that quite a bit, especially if patients feel like I hear a lot. I'm full just after I take my medications. If it's impacting what I call quality of life, meaning it's taking too long to take their medications, they're having bloating, especially if they're struggling with what we call dysphagia or difficulty swallowing. That's a perfect time to reevaluate medication appropriateness. So anytime I hear what I call change talk, patients want things to be different in their care. That's when I say, let's talk about that necessity or medication appropriateness and deprescribing. So that's something that I think is great if you're being an advocate for your parents or your loved ones, to just constantly keep that communication open, meaning now dad is struggling to take his medications or he's really voicing an interest in not taking as many, because a lot of things that help us with blood pressure or cholesterol, they benefit us if we start taking them early, but it doesn't mean we have to take them for the rest of our life. So anytime there's an interest or kind of a change in what I call status or quality, from your loved one's perspective, that's the perfect time to reevaluate some of what I call those long haul maintenance medications.
Okay. Kind of while we were talking about dosing, what if mom takes medications that are crushed? Kind of causes.
Yes. Yes, absolutely. So I love, I call it the crushability scale of a medication. Sometimes the way that a drug is formulated doesn't allow a medication to be crushed, or it's not intended to be that way. So if you take what is considered an extended release or, a coated type medication, a lot of times those are intended to be swallowed whole, and they have special formulations that release medications slowly over time. So even if you can crush one medication, it doesn't mean you can crush all medications. So I always say before you start crushing medications, or if you know that's going to be a need, call your pharmacist that dispense that for you. They can easily tell you if there are some medications that should not be swallowed whole. Some, for example, that impact pain or blood sugar can have a rapid release that then can be very dangerous when they kind of are exerting all of their benefit at once. So not only are you having an uncontrolled symptom or chronic condition, you actually could be putting your loved one or yourself at harm if you crush some of those meds.
Good advice.
Okay, so I'm going to talk then just very briefly. We get a lot of good data on some of these potentials for harm with hospitalizations or patients that are kind of leaving the hospital after something big or drastic happened to them. But sometimes that something big or drastic is the way that we're using medications. So I always like to just say that some of the examples that Bruce just asked great questions about can actually lead to a hospitalization or severe harm for patients. So, crushing an extended release medication, taking twice the dose if patients forget that they've already taken a medication. And so, we know that side effects or adverse drug events, meaning that avoidable patient harm, result in almost 1 out of every 10 hospitalizations in
Mm.
patients who are over 60. So to me, that's staggering because that gives us a lot of room for improvement when we're helping our seniors kind of manage their medications. We know this is more likely to happen as we age as compared to patients who are under 60 years old. And in the United States, 100,000 preventable adverse drug events happen every single year for patients that are over 65 years of age. And we know that 2 out of every 3 of those are unintentional, what we call overdoses. So it seems a lot of times when we hear overdose that patients, took something bad and on purpose, and that's not at all the case. Sometimes it's a dose that once was what we call therapeutic or where we wanted it to be is now toxic because something's changed as we age, or patients, as I mentioned, might take double the dose. And so, in almost 7 out of every 10 of those cases, we're seeing things that are impacting patients' therapeutic blood levels, meaning we're looking at blood thinning agents or anticoagulants, insulin products, antiplatelets, which of course are another way to kind of thin our blood and prevent clotting when we don't want it to happen. If patients have irregular heartbeats or they've had medical devices implanted, as an example. And then agents to monitor or control our blood glucose or our blood sugar. And so this is really important because we know a lot of us are genetically predisposed to have type 2 diabetes, or we might have taken medications that impact our blood sugar. So having something prescribed that helps us control insulin resistance or blood sugar over time is not terribly uncommon. And we know that the likelihood of that happening actually increases with age. And so if we have drug classes listed on the screen in place for our loved ones, this is a great opportunity to check in and say, how can I help? I love to ask someone, show me how you use this, because I'd like to know, and I'd like to see if there's anything that I can do to kind of assist you. It looks pretty complicated and you're doing a great job. So show me how you inject your insulin. Show me how you get that ready to use. Tell me how you would decide when to check your blood sugar. And that can be incredibly important to kind of have what I call shared decision making. because your parent or your loved one is the expert on being your parent or your loved one. So who are we to kind of tell them how best to use their medications or take their medications? We're really there to be their advocate. So if you're noticing issues with dexterity or vision when a patient, for example, is drawing up an insulin dose, that's the perfect time to say, let's talk to your doctor. There might be something that's a little bit better or prepackaged. We never know until we ask. We never know until we reset that expectation that things are different and this isn't an easy to use medication any longer. And so some of the challenges that we see as caregivers, those of us who are kind of planning and working along with our aging parents, are sharing of information. So how is the caregiver getting access to patient-specific information? How can they help ask questions and work with providers before medication regimens are changed? So even if you can't attend every appointment with your loved one, you can help them make a list so that they can take that with them. So sharing information, asking open-ended questions of your care team, incredibly important. Scheduling and logistics. So I'm always a big advocate of simplicity, right? It's hard to mess something up that's so simple anybody could do it. So when I mean that, I say ask for a once a day regimen. Ask your pharmacy if they can batch fill medications. Meaning, can you refill a few of my 5 medications a week early so that I can get everything on a single day? Can I come to the pharmacy once a month to pick up medications for my loved ones? That's going to prevent a lot of omission. Just because we forgot to pick up the 4th prescription that was filled on a different day. Um, the safety issue. So it's really important to me as a pharmacist when I'm counseling. I want to talk to my patient first and foremost, but I ask the open ended question of who else would you like me to share this information with? Right? Not would you like me to share this information with someone else? Who else would you like me to share that information to? So I'm not asking something that somebody can easily defer. I make it normal for my elderly or aging patients that somebody else might not need to hear this just to be my second set of ears. I'm a pharmacist. My husband's a pharmacist, and I will ask him all the time, "Hey, walk up to the counter with me. Just make sure you heard everything you felt like you needed to hear." And while I'm aging, I should be able to keep up with that as a pharmacist. So I just normalize, hey, who else should hear this? Because that's the best thing that we can do to prevent some of these errors of omission in aging patients. And then polypharmacy. So this is the risk of medication cascades, meaning we're prescribing one medication to help with the side effect of another, and we're getting lost in what's really doing good versus what's doing harm. And so here's where I can't advocate enough for deprescribing or being open to those medication changes that Bruce mentioned when your aging loved one says, hey, enough is enough, or you've noticed or you've heard them noticing a new side effect. So these are our challenges, but those are kind of some of my just quick tips for getting around them or kind of planning. So we want to make sure that we're asking questions, even if we can't attend appointments. If at all possible, ask for a written summary or send a list of questions with your loved ones. Scheduling, just the logistics of managing these medication regimens. Keep it as simple as possible. And I'm going to talk about some of the things to kind of ask your pharmacy or look into for a pharmacy here in just a moment. And then for polypharmacy, I just want to leave you again with some of just the statistics. There's nothing wrong or bad with taking 5 or more medications, especially as your loved ones are aging and they have chronic conditions. We know that a lot of those will require not just non-pharmacologic or non-medication related interventions. We know we're going to need medication statistically. But every time one is added, remember, ask why. Ask what the indication is and how long you think or your prescriber thinks your loved one should take the medication. Ask what some of the side effects will be like and how you'll know if it's beneficial. And then just ask, well, what would a deprescribing or discontinuation scenario look like? So we want to make sure we know why a loved one is taking a drug. We have the opportunity to weigh risk versus benefit, and we kind of understand that it would be normal in certain situations to deprescribe or discontinue a medication to avoid things like falls or future drug-drug interactions. because the patient's quality of life and what they want to get out of their medication regimen is incredibly important. So then some of the medication concerns as your geriatric resource here, we're looking at, again, our patient knowledge, their physical limitations, meaning can they prepare their medication regimen? Can they go to the pharmacy and access these medications? We know, as I mentioned, forgetfulness just statistically becomes more and more part of an everyday life. And patients get overwhelmed. And it's important to know that everybody ages a little bit different. Every illness trajectory, or kind of how we anticipate somebody progressing through a chronic illness, is different. Age impacts that. Gender, sometimes race or ethnicity, even just the way that our bodies are built, meaning some of us have better enzymes that are going to break down a medication than others. And so it's important, again, to just ask questions when med regimens are getting started. And this is just here for everybody's reference. You don't have to be a clinician, a doctor, a pharmacist, a nurse, a social worker, to see that people that are experiencing different types of illness, they might have a very different outcome. And so again, anytime something is changing, you want to ask your doctor or your prescriber, what can I, get out of this medication that makes it something that my aging parent, my loved one, can't live without? What are we going to benefit from in the next 2 years, in the next 6 months, or whatever the time of benefit is explained to be. So one thing that kind of summarizes a lot of what I've talked about, before I just leave you with some tools to consider with specific medication classes, I always, again, like to see kind of the data and where benefit is. So we've talked about where some of the harm lies, but the ACOV study is assessing care of vulnerable elders. And what they found to be some of the best things that we can do for our aging patients or aging parents who are kind of aging in place and living with chronic illness that requires medications. Again, document why somebody's taking something. Ask the why, right? Don't just leave with the 2 or 3 new medications from an appointment. Ask for additional education on what's going to, look like successful therapy, meaning what's the ideal benefit, and then what's the potential harm, meaning what are the most likely side effects I'll experience. Again, maintain a medication list and know that that might change. So just keep that current list. That's the current prescriptions, over the counters, herbal supplements. And then again, especially in the first few days or weeks of therapy, document the response, right? Or ask your physician or prescriber, might it take longer than that? I'm used to really following up closely with mom or dad to see how they're doing in the first week. But, for this drug, is that reasonable? And then periodically review the ongoing need for that drug. To Bruce's point, somebody might not want to swallow that many tablets. Somebody might be having difficulty with dizziness that's new. And it is important to question drug therapy and not just automatically attribute that to just aging in place or normal aging. So I get a lot of questions. What medication classes, or do you have a list of medications that I should really just be questioning? And then how can I make obtaining these medications and managing them as easy as possible? So some of the assistance that's out there, again, just asking the questions to understand a medication regimen. Some of the physical accommodations, meaning if it's hard for your loved one to get going in the morning, make it easy to get to their medications, right? A lot of people want to keep medications where they always have. And honestly, if it's in a cool, dry place away from children or pets who might inadvertently access the medications, you can keep them, in a bedside cabinet. You can keep them where it's just easy and in sight for your loved one. So just making sure that you can reach medications, you can get to them easily. And then one of my biggest successes with a lot of my patients is keeping medications as organized as possible, or having reminder devices. So you can ask your doctor, your geriatrician, do you have a favorite app that I could set a timer on my phone to just use that as a great time just to call and see how mom's day was. But since she takes most of her medications in the evening, that's a good reminder for me to follow up with her. Did she take the drug on time? And then when we say organization devices, that's as simple as a pill box. And a lot of those are available inexpensively with a morning and evening A lot of them will fit very handily into a bag if you have a loved one who's active and on the go. So just making sure that you get what's right and what can be seen easily by your loved one. So if you know that visual changes are a concern, a lot of pill boxes you can also get that have a different color for every day of the week. So you want to make sure that if this is a new intervention, that you're planning for, things might be a little bit different or feel a little bit different for your parent or your loved one, because these really do help with compliance. So if you're missing several doses a week and then you're adherent to the prescribed therapy, you might have more side effects than you had previously. So it's almost like restarting the drug. So be careful when you're using a pill box or a reminder device. And then reconciliation. This is what I mean when I say take that med list to appointments. Have your pharmacist review it if you're seeing your pharmacist more frequently than the prescriber, just to make sure that you're not missing anything. You haven't missed picking up a refill. So use every reconciliation opportunity, making sure that your med list matches your medical professional med list as well. So for those of you who like to just kind of see risk versus benefit for a process, when I say deprescribing, this is again part of good prescribing, meaning there is always going to be kind of a barrier. Sometimes clinicians are not comfortable. Drugs might have side effects as you wean off of them, but there are a lot of benefits like decreased side effects. A lot easier to swallow 3 tablets versus 7 at a time. So that reduced pill burden, and just again, have that open conversation that you almost expect change on your loved one's medication list when things are new or different in their life. And that will help really increase quality of life over time, which is what I find in palliative care and supportive care all the time. So then if you ask me, as a geriatric pharmacist, if I could only anticipate potential harm with an aging parent with certain medication classes, what would those be? I have to pick on what I call, or what is commonly called, an anticholinergic medication. And that's a big fancy word to say something that's really drying in nature. So it dries us out. It helps, kind of clear maybe sinus symptoms here in the South right now. It's pollen season, so allergies, right? A lot of the antihistamines that we might take over the counter, again, easily accessible in an OTC aisle, will have these drying side effects. And so we could have visual impairment because we're drying our tears. We can have constipation because we don't have as much wet visceral tissue in our gut because that's being dried. We can have patients that struggle with urinary retention, meaning they can't void their bladder when they need to. So a lot of things can also lead to confusion, not just changes in visual acuity or constipation. That can lead to falls, worsening confusion if we have somebody who's struggling with dementia. So look out for any new medications, again, that you start in the over-the-counter aisle, because this is where the danger lies with a lot of these anticholinergics. Then I also have provided some additional resources to Bruce, which I believe will be made available through maybe the National Institute of Health, and then also an article which references the Beers criteria or the Beers list. So in geriatric pharmacy, this is a list of medications that are potentially inappropriate. So notice I didn't say these are bad, avoid these. Just a list of medications that if you're starting a new drug for a loved one, ask additional questions. And you can access this list online, but they're really things that geriatricians, pharmacists that are trained in the care of elderly or aging patients say might be inappropriate because they are, cleared through a kidney. We know kidney function declines over time. They have a lot of drug-drug interactions. And so really, I would be almost like a detective when medications are being added to a med list. And so I'll close by saying knowledge is power. So knowing what to ask, incredibly important. And so as promised, I just made a little list. These are the practical questions that I would ask anytime I have a new medication started for my parent. So I'm going to leave you with these as a resource for you. And then additional kind of practical tips. If I could tell you to do the following things, and that's going to improve, avoiding that error of omission, meaning these things are going to help you take medications as prescribed on a regular basis. Keep that current list and keep it with you. Store your medications safely, but easily accessible by your loved ones. Keep them organized with a pill box or a memory reminder, like an app that's going to make a noise or light up when it's time to take a medication. And then you can be very selective with your pharmacy. So make sure that you're choosing a pharmacy that offers maybe blister packs. They might be able to package medications. You don't even have to load a pill box. They can send you a kind of a scorecard for the month. And that's going to make it really easy to remember, did I take Thursday the 21st medications for my evening dose? And then just constantly be reviewing your medications with your parents. Just run through, how was your appointment today? Did anything change? Do we need to get this medication in the pharmacy's blister pack? So open, honest communication that happens very frequently, incredibly important. So when I say this is a practical tip, I mean it. This is my father's medication list. And so we keep this electronically. I'm sharing it with his permission. But we keep it with him because sometimes his doctors will call his simvastatin for his cholesterol Zocor, and he doesn't know what that means. He's wondering, have I missed a medication? So we keep the brand, we keep the generic, when he should take it. And if he had multiple prescribers, I'd also include that because you want to know what's coming from your primary care provider, and he takes this along with his bottles to every appointment. So keep this medication list. When I say that, I thought I'd prove it. I am a daughter of an aging father who isn't necessarily technology savvy, but he knows he's going to call me and I'm going to update this list for him. And then my mom wants to manage her own. So really just making sure that that happens in a way that meets your loved one's needs, incredibly important. So that medication reconciliation, again, keep that list with you. Take it to all of your appointments. If you ever hear somebody say medication therapy management, be curious about that, because that usually involves somebody who's trained in evaluating your medications and their side effects and coming up with a workable plan that no secrets here, involves the safe storage and ingestion, meaning how you take the medication, with a plan to report problems. So some of the kind of practical tips that I've included as a geriatric pharmacist is, how will you follow these instructions? What will it look like for you to take medications on time? And sometimes it's turn on the light, which seems kind of obvious or simple sometimes. But if patients are tired or they're groggy, or, they're sensitive to light with headaches, or just takes them a while to get going, imagine having 4 different medication bottles and you have to triage which one to take. So just make sure that your loved one is in a safe physical area, and just report problems. And again, make it normal to talk about cost, accessibility, just usability of a drug product, because that's one of the worst errors we can make, is just assuming someone else can do what we think we could do. And then, of course, I've already talked about organizational reminders. This is my father's medication pill box. And so we're able to kind of keep things separated. For him, having a morning and an evening pill box, he refills this every Saturday night. And that's a plan that's working well for him. He keeps it in a well-lit, room that's just outside of his bedroom. And so he kind of passes by it morning and evening. He doesn't have grandkids that go upstairs or that can climb the stairs by themselves. So we've done the safety check, and it's something that he can use readily. He also has a pharmacy that is the single source of his medication. So as a pharmacist, that's kind of something that makes it really hard to manage your medications if you're using my pharmacy and one across town. So you can shop for your pharmacy just like you could shop for your groceries. Pick a store that you like, that's convenient. They might have delivery. They might have blister packs. Build trust, have a plan, have that treated as a medical appointment, just like you would at your doctor's office. And so I'm going to close by saying, you see an asterisk that says, what does your favorite geriatric pharmacist say? So I'm not going to say I'm your favorite, but hopefully I'm your favorite maybe while you're listening to this. And so these are Ellen's favorites, because as I shared, I'm a wife, I'm a daughter, I'm a geriatric pharmacist. I'm not just somebody, I hope that my patients feel dictate to them, but I would say write it down. Right. So have a list that you take with you to your appointments for questions. Have your list of recommendations that you feel comfortable with that you walk back out with. That medication list should not be stagnant. That's my tagline. Be open to changes, including deprescribing. And again, I believe in this so much. Write it down. You can type it, you can text it, but just have a written list that you're able to communicate back to your prescriber before you leave. And then keep it simple. Make it work for you. So with that, I'm going to turn it back over to Bruce and Michaela, and I'm going to leave my contact again: wife, daughter, sister, friend, pharmacist. We all kind of wear all these hats, but if I can help you in my role as a pharmacist, I'm glad to.
Very good. Ellen, you mentioned the pill boxes and so forth. Any recommendations that you might have in terms of the types of pill box or other remedies such as blister pack or other types of things that work out well?
Absolutely. So I usually go with a blister pack or something that the pharmacy is helping manage. Anytime there's an issue with a parent or a loved one, just kind of seeing or planning for themselves, meaning it would be difficult for them to fill a pill box. So even just opening 8 containers of medications, keeping it straight if it's morning, noon, or night. If it's just a simple regimen that your loved one feels that they can manage in the home, I pick a pill box that's easy to open the compartment, that will fit into a bag if I want to take it with me. And I love the options that have a different color for each day, just because it's another reminder that you're kind of progressing through the week and you haven't forgotten a day. And Bruce, I also like to sit that with a calendar. Sometimes it's easy to lose, just is this Wednesday? Is this Thursday? It just helps with orientation, which is really helpful as well.
Yeah, very good. Okay. So as we're, as our doctors kind of discharging medications and narrowing down that list, what would you say to, what should we be doing with those medications that we no longer take?
Gotcha. So if you have a physical supply of a medication that you no longer take, so this is a great. April is always kind of National Drug Take Back days in most states. So I always start with my pharmacy. If they don't have a take back program, meaning a mail away envelope for destruction or something they can give me to just destroy medications in the home. Your local law enforcement also usually has a drop box, especially if it's a dangerous medication to place in the trash. You can also go to the National Institute of Health website, the FDA website, and they'll have excellent instructions for combining unused medications with things like used coffee grounds, kitty litter that you can then put something, kind of a mixture in a bag that then you can put into the trash safely. And so you can get a list of safe medications to dispose that way from your pharmacy as well.
Great, thank you.
And just one last question I had. You had talked about maybe looking in generic brands for some medications, but are there
Mhm.
any other resources for getting medications at a reduced cost?
Yes. So a lot of county-based programs, either through your health department or even kind of like Bruce was mentioning, just making sure that you have patients signed up for the appropriate level of kind of Medicare services. Some individuals will have kind of an income-based subsidiary plan that will kind of help with the cost of their medications. And additionally, if it's something that's going to be a high cost, sometimes physicians will also have samples that they can provide to make sure it's the drug for you before you purchase an entire month of medication. So I would say county health departments are a great resource. People that are kind of helping with planning for different Medicare types of plans. And then sometimes your pharmacists are great resources as well, to just recommend something that might be cheaper, even in the same drug class, not the same medication, but the same class.
Well, awesome. I want to thank you so much for your presentation tonight and all your knowledge that you had on, proper medication and all your, even your little thing about organization with the pill boxes and keeping a calendar with it. So those are all great and helpful hints as well. Again, I just want to thank our sponsor, the Health Insurance Shop, for sponsoring tonight's program, and for Ellen for being on here, of course. And just a reminder of our next two upcoming programs. Our next one will take place on May 19th. communicating with someone living with Alzheimer's and other dementias. And we look forward to seeing everyone again then. Again, thank you, Ellen, for your time tonight.
All right,
Thanks
thank
for
you, Ellen.
having me.
All right, good night.
Thank you.
Good night, everyone.